It is a troubling trend. More deaths are being linked to colorectal cancer. We've seen the disease hit Hollywood with both James Van Der Beek and Catherine O'Hara dying a few months ago.
We have questions about this type of cancer, and so we invited Dr. Joleen Hubbard to join us today. She's an oncologist with Allina Health, and this is such an important conversation. We're so glad you're here because you are seeing things change. What do the statistics tell us about what's going on here?
So overall, the colorectal cancer is the third leading common cause of death among cancer for both men and women. And we can expect about 130,000 new cases per year and about 55,000 deaths per year. So a very serious problem.
And you also say it's the third most common cancer diagnosis.
Yes.
I mean, this is something a lot of people are experiencing.
Yeah, and we were talking a little bit earlier, and you were saying the people who are being diagnosed, that has changed too. Can you talk about that?
Yeah, so what's really interesting is for the age group of over 50 that the incidence is going down because of all the efforts with screening over the past couple decades. But for people ages 20 to 50, we're seeing a rise in the incidence about 3% per year over the past 2 decades for reasons we don't clearly understand.
Interesting. So based on what you do understand, what can people do to take charge of their health? Anything people can do to reduce their risk here?
Yeah, definitely. There are several lifestyle modifications. So I think the most important thing is diet and exercise. So we like to see lots of fruits and vegetables. We like that all the colors on your plate, high fiber, lower in red meats and processed meats. And then exercise is extremely important. And it doesn't have to be terribly strenuous. You know, you could do 30 minutes of walking a day, significantly lowers risk.
And Dr. Hubbard, are there risk factors that we really can't do anything about?
Right, so we can't do anything about our age, and we know in general colon cancer increases as we age. We can't do a lot about our family history. So some patients have early onset colorectal cancers in their family, or they're born with an inherited condition that causes colon cancer. Other things like colitis, so Crohn's colitis, ulcerative colitis, that's a very high risk group that is predisposed to developing colon cancer. So those are all things that we may want to screen earlier based on the risk.
And there are racial risk factors as well?
Yeah, we know the Native American population and African American population, they have a slightly higher incidence.
I want to talk about it though, because we talk about family history a lot with cancer, and I find this interesting because, I mean, you are connecting some dots that there could be environmental factors, maybe diet, right, and lifestyle. And so have screenings changed to address that younger people are seeing cases of this type of cancer?
Yeah, so recently the age of starting screening colonoscopy was lowered from 50 to 45, which is a good first step. But for people that have a family history with early onset colon cancer, we recommend starting 10 years prior to the diagnosis of the age of that patient and starting with colonoscopies at that time. So there are various things that, changing the screening recommendations based on your family history.
You were talking about family history, but are there other symptoms or early symptoms that people get that it's a sign that you should get checked?
Yeah, so one of the most common things I hear is rectal bleeding. Bleeding with bowel movements, pain with bowel movements, abdominal cramping, or just a general change in bowel habits in general. Losing weight when you're not intending to can be another sign. Or some people just present with fatigue, they're found to be anemic, and then it turns out they had a colon cancer and slowly losing blood over time.
Yeah, some are more covert. I think that's interesting. Where can people learn more and talk to their doctor, all of that?
Yeah, so the American Cancer Society has a fabulous website, a lot of information for patients. We have information on our Allina Health website as well. And then if you're concerned at all, talk with your doctor about what age is appropriate for screening for you.
All right,
that sounds great. Pay attention, really, right?
Yeah, exactly. Those really symptoms are very important, especially in younger patients where the average physician isn't used to seeing colon cancer in that age. You really got to speak up about these symptoms.
But things are changing, so we appreciate
Thanks so much, Dr. Hubbard, for coming in.